Kia ora, tēnā koe. Fee Jamieson-Folland, the lifestyle aligner, helping you live the life you love. So, here it is. Women are at a higher risk of heart disease, especially for those of us women who are 50 and over. And that's for a variety of reasons. And okay, so we know that that's so. What can we do about it? And that's what it's all about. We're all about this week in this video, but also in the blog. And I would be here for a long time if I attempted to explain to you everything in this video. And so I'll just touch on the fact that, you know, our hearts are it, really. It's a little bit like that kind of classic thing that we all hear. It's like we get one, it's like our bodies are like a car and we get one of them for life. So how would we treat it if we knew that? And, you know, for me, that's so real. Having witnessed that in action, I was just thinking about it earlier. You know, my dad died at 50 of a massive heart attack, and he was so strong and well and seemingly on the outside. And his father died young, in his 40s, of a massive heart attack. My uncle, so my dad's brother, has had quadruple bypass surgery. And then my dad's mum had complications with cancer, but she died of aortic stenosis. And then on my mum's side, there's cancer for her and her father. And then her mother died after 4 strokes. So for me, I mentioned men there, but also women, especially from the heart disease side of things. And so it's a scientific thing. So there's a couple of reasons for this. One of them is the protective effect of estrogen, which reduces after the age of 50 for women. It's very much a protector when it comes to many tissues in our body, but especially our cardiovascular tissue, and helps to reduce the inflammation in our bodies. And the second reason is, and I've got it right here to help me to remember everything I'm going to say to you. And secondly, because of the issue of the symptoms for women who are experiencing heart attack. And they're so subtle that for oftentimes women will brush them off. So you might just feel a bit of fatigue, a bit of nausea, shortness of breath, a little bit of jaw pain, or even a slight indigestion. And that, you know, they can easily be brushed off as just having a bit of one of those days. And this is the reason that it's interesting. A 2020 study in the publication Circulation found that women are less likely to receive timely interventions like angioplasty, like remodeling the arteries that serve the heart, partly because our symptoms are misdiagnosed or dismissed. So we go through 6 preventive strategies, ranging from what we put in our body as fuel, to the way that we move our bodies, the way that we tame stress. That's one way of thinking of it. So check it out, because the risk is real. And I think for many of us, men and women, we kind of learn to soldier on, which is okay to a point. And it's also okay to make sure that we're looking after ourselves. So, as always, it's great to hear from those of you who have a chance to message me. You make my day. And looking forward to seeing you next time. Ciao for now.